So we're going to move on now to the next talk about integrative oncology at the Hillman Cancer Center. And this presentation is going to be given by Dr. Lanie Francis.
Hi. Let's see. I'm just sharing my screen. Hi, everyone. Thanks for having me talk. I think this is the last part of the symposium today, and I'll give you a second to just, take a deep breath. You heard a lot of information and from a lot of experts about a lot of interesting and complicated and probably overwhelming topics. So this will be just something to sort of watch and listen, nothing to really worry about or take in or take notes on. I am a medical oncologist at the Hillman Cancer Center in Shadyside, and I run our Wellness and Integrative Oncology program. And that is a program with a lot of components, which I'll highlight some of today. It is a space as well as various programs, different ways to interface with medical providers and integrative therapists, all focused on managing symptoms and quality of life for patients with cancer. So this first shot of my slide presentation is a view of our wellness suite and studios, which is on the third floor of the Hillman Cancer Center. It is a brand new space that officially opened a little less than a year ago. And it's about 3,500 square feet of clinic rooms and also various spaces, all focused on our wellness and integrative oncology program. So this gives you at a glance an idea of what we're doing in the wellness suite and studios. I want to focus for most of the talk on our integrative oncology consults. That's something that may apply to many of you as patients with melanoma and maybe of interest to many of you as caregivers and loved ones of people with melanoma, whether that's active melanoma on treatment or survivors or even people with strong desires for prevention. And in the integrative oncology consults, myself and my nurse practitioner, we see patients in sort of a very pleasant, non-medical setting to talk about your cancer, your symptoms, and lifestyle and integrative goals. That might be in regards to diet, it may be in regards to exercise, it may be in regards to stress reduction through mindfulness, it may be in regards to symptom modulation with or without other pharmaceuticals in terms of things like acupuncture or yoga or medical cannabis. It's a very patient-centered approach where you have time to really talk, and we are there to problem solve and advocate for you. We have a dietitian who is focused on a more holistic approach as well as a more personalized and collaborative approach. And we will, after the consult, sometimes connect you with the dietitian. We have a yoga and meditation practitioner. We have an acupuncturist, and you'll see reflected in the rest of the weekly schedule that all of these are available for you as you enter our program after an integrative oncology consult. And again, very focused on you, your time, and your resources. Our nutrition program is really exciting. We have a beautiful state-of-the-art teaching kitchen. And in addition to a very personalized approach to meeting one-on-one with our lifestyle dietitian, we also have streaming classes, cooking with cancer classes that are question and answer, very interactive and focused on things like getting more protein in your diet, how to snack when your appetite is low, taste changes associated with cancer. And also these cooking classes, as well as your interaction with our dietitian, can focus on questions you may have about sugar, keto, intermittent fasting, even some of the big question mark black box questions around supplements and probiotics, which you've heard a lot about, things like that today. But, how can you as a person in real time be thoughtful and safe about what you're putting in your body? I work really hard with my colleagues, Dr. Dwakar, Dr. Najjar, to make sure that what you're doing is safe and they're aware of it, that we're working with PharmDs and clinical trial specialists if you have questions. So please don't be afraid to come and talk to me about what you're interested in, what supplements you're thinking about, what your daughter-in-law or brother or friend in California told you have to take. We are there to be safe, supervised, non-judgmental, and also open-minded. So that's a little snapshot of what we are up to in the Wellness Suite and Studios. We have a large and growing team. As you can imagine, this area of oncology is extremely popular and growing, and we are set up to be very helpful and make your experience very streamlined. We have myself, a nurse practitioner, a collaborative nurse, a project manager who works on some of our research and partnerships and quality improvement. We have a coordinator who schedules. We have our dietitian. We have an acupuncturist. We have a yoga therapist. So all these people are there to help make this program work. We think a lot about the stress of cancer, the stress of this pandemic, and how to be a sort of sanctuary for thoughtful and kind behavior within our cancer center. So I think of our Wellness Suite and Studios as something of a refuge. Not to sound hooky or wah-wah, we do think about energy and responsibility and kindness, and we really live by that responsibility. So this is a shot of one of the message boards in our space, because we really do ask you to take responsibility for the energy you bring into our space. We believe your words matter, your behaviors matter, our patients and our staff matter, as do you. I mentioned our nutrition program, which again is growing, but I did want to alert you to our Cooking for Cancer classes. They are only on Wednesdays now to streamline that. They're at 9:00. This is the Zoom link and anyone can join. If you want to take a minute and snapshot this slide for your records, these are lovely. Our project manager and dietitian cook a different dish each Wednesday. They tell you how to do it. They talk to you about different tips within that. And it can become a really helpful community for people that are trying to think about how to eat with cancer, after cancer, during cancer, as well as for caregivers that want to be a part of participating and find a way to have some control in this disease and in cancer in general. Well, sometimes it feels like we have no control. We also similarly have Movement for Cancer classes, which are also available to join. These are run by our meditation and yoga practitioner. She's also, as a part of our program, able to see people one-on-one to talk about what is yoga, what is breath work, what is mindfulness. That service is accessible after you see me or Kayla, my nurse practitioner, in consultation. This background snapshot is our yoga and movement studio, also on the 3rd floor, beautiful sun-filled space where we teach yoga one-on-one and in groups, and are continuing to expand this program. So finally, again, it's not showing up very well, but if you snap a picture, this is our website. It's hillman.upmc.com/cancercare/integrative/oncology. This is our phone number to make an appointment. You don't need to be referred. You can call and make an appointment no matter who you are or what you are. A typical copay may apply. Services, when recommended, are sort of curated to you and your symptoms. Patients that are interested can get 3 demonstrations or complimentary sessions to try things like acupuncture or yoga. We fundraise for that, so everyone can try these to determine if they're worth their time or effort. If people want to continue with acupuncture or yoga, then there's a fee for service. The way our program is structured, we do collect the fee for service at the time of the visit. If your insurance company will reimburse you on the back end, or if you have a health spending account, that's ways, and we are there to navigate and help you with this process. But everything is there for you to try and get involved in without significant cost. So I hope that is a nice way to end. Again, we're here for management of symptoms, management of quality of life. I am a medical oncologist in touch with and aware of the complicated treatments that you are on or considering. We are a place for advocacy as well as sharing space, there to help and be a way to meet you halfway in a very patient-centered approach. So I'll stop now. I thank you very much for your time and for allowing me to be a part of this. Thanks to the organizers as well. And take care.
Thank you very much, Lanie, for this very informative presentation. And I would like to thank also all the speakers for their great presentation. I hope it was very helpful for everybody who attended this meeting.